Good morning, everybody. I'd like to thank everybody so much for coming to our virtual Red Table today. It's a pleasure to be back at the virtual Red Table with everybody. My name is Lindsay Idaluca. I'm going to be facilitating the discussion today. I am a member of the American Heart Association, and I'm very excited to introduce to you two Lifespan physicians. I'd like to thank Lifespan for joining up with the American Heart Association for this as well. Dr. Megan Rainey and Dr. Tracy Madsen. Thank you so much. Dr. Megan Rainey is the co-leader of the Long COVID Research Initiative at Brown University and an emergency physician, researcher, and national advocate for innovative approaches to public health. I'm sure you guys have seen her on national TV quite a lot in the last year. And Dr. Tracy Madsen is the co-director of the Comprehensive Stroke Center at Rhode Island Hospital, an emergency medicine physician. She's the director of acute stroke services in the hospital's emergency department and the associate director of the division of sex and gender in emergency medicine. Thank you so much for being here. Again, thank you to our guests. And the focus of the discussion today is going to be COVID and heart health. So Dr. Rainey, we're going to start with you. You're studying long COVID. What are you seeing in terms of a connection between the two, long-term heart health and overall health being affected by COVID-19?
Lindsay, thank you. And it is such a joy and honor to be with all of you today. I'll note I wore red in honor. So it's interesting, right? So long COVID is a very real syndrome that is to date relatively poorly defined, partly because COVID itself is so new. But the idea behind long COVID is that somewhere around 20 to 40% of folks who have COVID, both symptomatic and asymptomatic, develop long-term symptoms. Preliminary studies show that if you catch COVID, if you catch SARS-CoV-2 and develop COVID symptoms, you have more than 16 times the risk of myocarditis or inflammation of the heart muscle compared to people who get sick from other things. So there's a huge risk of heart disease just in the acute COVID period. There's also an increased risk of MI or heart attack. And there's an increased risk of death if you develop heart problems during COVID compared to if you develop heart problems for other reasons. So having the disease in the acute phase is really bad for the heart. Of that 20 to 40% who survive the initial COVID infection and go on to develop long-term symptoms, in some studies, as many as 78% of people who survive that initial COVID infection have heart inflammation or heart damage. That's even among people who were asymptomatic at the time of their initial COVID infection. Now, that may end up being an overestimate. That's a preliminary study, and we're still figuring out a lot. But what is clear is that COVID does damage heart muscle in a wide variety of ways that we're only just beginning to investigate. This is one of the things that we're looking at in our long COVID project. That's a collaboration between the School of Public Health, School of Medicine and Lifespan, and Rhode Island Department of Health. But there are so many things that we don't know yet. Really, again, the short version is avoiding getting COVID is good for your heart.
Yeah, of course. And just a quick follow-up question. Have you seen, I know that this is very obviously preliminary and new, as you said, but have you seen an age discrepancy? Do you think that it affects the older population's heart more so, say, than those that are in their 30s, or does it not matter?
It's a great question. We really don't. I wouldn't want to say definitively one way or another. I will say that in general, the older you are, the higher your risk of having all kinds of bad things happen from COVID. But Dr. Madsen and I have both taken care of in the emergency department numerous young people in their 20s, 30s, 40s with no pre-existing problems who developed acute heart problems, blood clots, coagulation disorders, regardless of their pre-existing health after catching COVID. So although old folks are going to be more likely to develop problems just because in general, any illness is going to affect them more, we younger people are certainly not immune to the negative effects of COVID. And the other kind of thing that I'll say here is that a lot of times when we talk about the fact that older people are at higher risk from COVID, people say, well, you know, that means that as a young person, I don't have to worry. I try to think about it in terms of relative risk. We as younger people and our children as well are at low risk of all bad things happening. right? Young kids are not likely to die. 20, 30, and 40-year-olds are not likely to have heart attacks in general. So even though COVID might increase our risk, not as much as it increases the risk of older people are more likely to have heart attacks and die, comparatively to our baseline risk, because we don't get heart attacks a lot, we don't get this kind of damage a lot, it still is a significant increase from what we already experience. Does that make sense?
That does, and that's so important to note, because no, you're right. Younger people are not immune. Dr. Rani, thank you very much. Dr. Tracy Madsen, as a leading expert on stroke treatment, I want to present this question to you. Can COVID-19 infection increase your risk of stroke? What is the connection there?
Sure. So thanks. As Dr. Rani said, I'm really excited to be here and to talk about this topic. It's so important. And as you pointed out, there is a known association between COVID-19 infection and the risk of stroke. We've seen several papers come out since the beginning of the pandemic that have demonstrated different types of blood clots can happen in patients with COVID-19. So this includes blood clots in the brain, in the arteries and veins of the brain. This is not quite as common as blood clots in other areas of the body, like the lungs, for example, but we do see an elevated risk of stroke in patients with COVID-19. We see in data that's come out from kind of large registries, so large groups of patients hospitalized with COVID-19, the risk of stroke is between 2 and 3%. But we also know that if you get a stroke while you have COVID, the mortality risk at that point jumps up by about 40%. So this is a really important risk to think about. And this includes young patients, older patients. Again, as Dr. Rani pointed out, this can affect patients of any age group, not just older patients.
Absolutely. And 40%, I mean, that's a terrifying number. That's pretty large. So this question is for both of you. Where we are right now as it relates to the pandemic, how do you see things moving forward? A lot of people are wondering, particularly now that vaccines are available for ages 5 to 11. Who wants to go first?
Dr. Madsen, do you want to go first, or do you want me to?
Sure, go ahead, Dr. Rani.
All right. So I will say we are at a dramatically different place than we were a year ago. So I'm going to start by saying that where we are today is so much better than where we were a year ago. And I say that both based on my own practice and Dr. Madsen's as an emergency physician, what we're seeing every day in the emergency department, and based off of national data. The availability of vaccines and the percentage of folks that have been vaccinated is truly transformational. Now, the vaccines are not 100% effective, but nothing is. The comparison that I often make is to seatbelts, right? None of us would get in a car and not wear a seatbelt. Does a seatbelt guarantee that I'm not going to end up in the ER after a car crash? No, but it sure as heck decreases my risk of a severe injury by a lot. Same thing is true for the vaccines. They are unbelievably effective as vaccines go at preventing disease, period, but particularly severe disease and hospitalization. And what that means is that although there are still some people getting infected who are vaccinated, their risk of severe disease is just dramatically lower. It's somewhere around 10 to 12 times lower than people who are unvaccinated. So we're in a super different space for those of us who are vaccinated. Unfortunately, there's still a lot of our population who has not yet been vaccinated. And what we're seeing across the country is a surge in infections, hospitalizations, and now starting to see again that kind of hospitalization and death number go up as we get into colder weather, mostly among the unvaccinated. So this fall and winter are going to be tough. We're certainly going to see surges, but it's very different from last year. Two really exciting things. That vaccination of 5 to 11-year-olds. I took my little guy to get his vaccine last weekend. And right, it's huge. And again, he's not super high risk of getting sick. Chances are if he caught COVID, he'd be okay. But I don't want to take any risk with my kid. And he can serve as a spreader. So if he caught it, he could pass it to me. He could pass it to immunosuppressed people in the community. So that vaccination of kids is going to be really helpful. The more of us that are vaccinated, the quicker we get this under control. And then there's other kind of good stuff on the horizon as well. There's some new medications that are coming out from Pfizer and Merck that we can take by mouth that are going to be helpful, that are going to get us to the other side. unfortunately, we do have to kind of hold on a little bit longer. I do think that the fall and winter are going to be, we're going to see increased surges again and increased cases, but I don't think it's going to be anywhere near what we suffered from last winter.
Well, good news there, and I'm glad that you bring up the age group of 5 to 11 being transmitters, because sometimes people don't think of that. They're like, well, my kid's okay, but what about the possibility of them spreading it? So, Dr. Madsen, the same question to you. How do you see us moving forward, and especially with that change of the vaccinations being approved for 5 to 11-year-olds?
Sure. So I think it's super exciting to see the vaccine available for this age group. We know that over the last couple of months, the 5 to 11 age group has comprised a large proportion of new COVID cases in the country, which is really concerning because although we know most kids have mild illness from COVID, many kids are getting sick and are getting hospitalized. So this is just really exciting for parents of young children, but really for everybody, because as Dr. Rani points out, these kids transmit COVID too. But we have so much work to do to get more kids vaccinated. And one of the questions I've heard is, should I get my child vaccinated if they've had COVID? Maybe your child had a case of mild COVID. Oh. And we also know that it's really important to boost those antibodies to get the vaccine, because the antibody response to the vaccine is generally more robust and more consistent than actually having COVID. So we have a lot of work to do to get more kids vaccinated, but I am hopeful for hopefully a better winter than we had last time, just because of the pure number of people that are vaccinated at this point.
Yeah, absolutely. That's a great point to make. And to kind of piggyback off of that, is there a time limit for children and for adults? People want to know, when I've had COVID, when can I get the vaccine? What is the time there?
So we've learned more about this as we've learned more about COVID at the beginning of the pandemic. And then when we first got the vaccines, we had slightly different guidelines. But as we get more data, we have more reassurance that you can get vaccinated basically as soon as that acute COVID infection is over. And so that's great news. You don't need to wait 3 months or 6 months or some extended period of time. Once that acute infection is gone, so generally 10, 14 days, it's okay to go get your vaccine.
That's really important. No,
I'm going to add on there. You can get your COVID vaccine and your flu vaccine at the same time. For
you those can. Okay, because that's definitely something that people have been curious about, if they have to wait a certain amount of time as well.
No, the only reason to wait for the COVID vaccine is if you did get monoclonal antibodies. You should then wait 90 days. But otherwise, no reason to wait and get. You can get all the vaccines. There are a couple that we don't mix, but COVID and flu can be mixed.
And what about the COVID boosters and the flu vaccine?
Also okay to get at the same time.
That's wonderful. That's great.
Many of our colleagues did both together.
That's great, because some people just want to get it out of the way. I mean, my grandmother is 93, so she only wants to go once and get it all done. Well, ladies, thank you so much. I want to say thank you to Dr. Rani and Dr. Madsen, and of course, Lifespan, for allowing us to share this very important message with Southern New England. Just as you ladies said, we're looking toward the future, and we're hopeful, but it's not quite over yet. So thank you so much for this conversation, and pleasure to have you at our virtual table.
Thank you for having us.
Thanks.